The agency reported today it's now investigating more than 100 severe cases in young children. That's up from just 11 2 weeks ago. At least 90% of those kids hospitalized, 14% needed liver transplants, and 5 children died. Health officials say they found cases in at least 24 states, the one here that are shown in blue. According to the CDC, they've traced cases back to last October. The agency issued a health alert last month, warning doctors to be on the lookout for unusual cases of liver inflammation or hepatitis in young kids. CNBC's Meg Terrell covers science and medicine for us, and she's on the top story at the bottom of the hour. Meg, do the experts have any idea what's causing this?
Yeah, Shep. Right now, one of the leading hypotheses is a link to a virus known as adenovirus, and specifically one called adenovirus type 41. Now, usually adenoviruses cause respiratory symptoms, but type 41 typically shows up in kids as diarrhea, vomiting, and fever. And while the CDC says there have been links to liver issues with this type of virus before, it's always been in kids who are immunocompromised. And one of the most confounding parts of the situation now is, at least among the earliest reported cases in the U.S., all of the kids were previously healthy. And the CDC said today that more than half of the 109 patients under investigation had evidence of an adenovirus infection. And similarly, a report out from the UK today notes 72% of cases who were tested for it had adenovirus. That compares with 18% who had SARS-CoV-2. Altogether now, there have been more than 360 cases or suspected cases reported from the US, UK, and Europe. And scientists haven't ruled out COVID, but it's not their leading hypothesis. The CDC said other factors could be at play, like environmental exposures, medications, or other infections. This is what disease detectives all over the world are trying to figure out now. What do these cases have in common? The UK even noted that a lot of the affected kids had exposure to dogs, and it's looking into whether there's any connection there. But it also points out a lot of families in the UK have pet dogs. One thing that has been ruled out, though, is COVID vaccines. Most of the kids affected were too young to have been eligible for vaccination. The median age in the U.S. of the first cases is just 2 years old. And while this is certainly concerning, the CDC emphasizes these cases are very rare. Signs of hepatitis to look out for are vomiting, dark urine, light-colored stools, and yellowing of the skin or jaundice. It recommends kids be up to date on all their vaccinations and that caregivers take the usual precautions to avoid infections like washing hands and staying away from people who are sick. Things we're pretty used to. Shep?
Indeed. Meg Terrell, have a good weekend.